The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Welcome everyone to the Success in Practice podcast. Today I'm joined by John Abdullah. I'll just give everyone a bit of a brief background about John. John is the owner and operator of Triple H Osteocare, located on New South Wales Central Coast in Australia. He's been a qualified osteopath since 1990 after completing his osteopathic studies at the International College of Osteopathy in 1989. He has completed a Master's in Musculoskeletal Pain and a Diploma in Vet Chiropractic. He began practicing with Ivan Lullerman and took over his Bondi Junction practice while establishing the Peakhurst Osteopathic and Sports Medicine Clinic in Sydney's southern suburbs, where he grew up. After selling the Bondi practice in the late 90s and his Peakhurst practice in 2012, John focused on developing his practice on the Central Coast, where he had moved in the early 2000s. He's married with 3 children, and one of them has helped him set up this podcast. So thanks, Jeremy. And he lives on the Central Coast. He grew up in Peakhurst and went to Peakhurst High School, crediting that time as forming the resilience he would use later on in life and in practice. When you talk to John as much as I have, you pick up that he has a very palpable respect for osteopathy and its principles. He's all in on the ideas that underpin what we do as professionals, and really speaking to him, you get the sense that he loves what he does. He has a special interest and is widely regarded as a manipulative expert with HVLA and HVT. He has a deep understanding of biomechanics and pattern recognition. If that's one area that he's taught me, it's pattern recognition. So he's very well attuned to that. And in recent years, he's added biodynamics to his osteopathic arsenal. John, let me first thank you for joining me on the podcast, mate. It's great to have you on. We always get a chance to talk about osteopathy whenever we meet, but I guess today we'll be giving people a little fly on the wall experience about how that normally plays out. So thank you for your time. I know it's late, and I really appreciate you being here.
Thank you, Sammy. It's good to catch up.
Mate, before I just discuss what we want to do today with the podcast, I just want to personally thank you publicly for everything that you've kind of done for me and for the mentorship that you've offered. A lot of the things that I've been able to do today, especially in practice, I've learned from you. So, mate, I feel like I'm standing on your shoulders with what you've built down there at Peakhurst, and hopefully we've been able to do it justice. I just wanted to say thank you for everything, mates. And I know that a lot of people out there, like myself, who you've helped, would also feel the same way.
Thank you, Sammy. I'm glad you feel that way. I like to I've just sort of done what everyone else has done previously. I basically had mentors when I was a student, and they passed down a lot of their knowledge and experience, which helped me a lot. And it's something that I like to give back to osteopathy and to some of the young students coming through.
Well, mate, we're definitely grateful, and there's a big need out there for it. So let me just discuss what we want to talk about today in the podcast, just to give people an understanding of where we're going. So I think the best value we can get out of today is to really go deep diving into your clinical experience. I just want to explore your clinical experience and understand really how you perceive the concepts of osteopathy, and then how you make those play out in your practice. Sometimes I feel like there's a bit of a misconception that the principles that we use to practice are somewhat arbitrary, or they're just floating around like ideas in the sky. But mate, you've been able to really take those ideas and put them into practice. And I know that that's one of the things you've taught me, but I really want to discuss that with you, and just to give people an idea of how you've gone about doing that in your practice. Also, obviously, the technical aspects of practicing, we'll ask you about that, but you've built some busy clinics along the way too. So you'll have some business know-how. We might ask you some questions surrounding that, and also how osteopaths themselves, how you feel they've changed over time. You've seen them over many decades, and you'd have some good experience around that. You've mentored both osteopaths and chiropractors, and over the years, you've noted to me some differences that you've noted between the two professions and the two personas, I guess, of chiropractic and osteopathy. And so maybe we can ask you some questions around that. And then if we have time, we could also look at the current landscape of osteopathy in Australia and where you think the future is headed and what some of the challenges you see ahead of us. So if there's anything else that you want to discuss, please, feel free to kind of segue into a rabbit hole, and we'll follow on, because I think anything you have to say will be very useful. So I'll just get straight into the questions, so that way we can kind of, get into it. So we'll get to the clinical side of things in a minute, but first I just want to give people some context around your history, your particular evolution in osteopathy. Mate, how did it start for you? What got you into osteopathy, and where did you learn? Where did you learn osteopathy?
Okay, it started many years ago when I was a student at high school. Really, I was 16 at the time. I was an athlete, a high level athlete as that, and I used to get a lot of injuries from the sport I used to do. So you do your rounds, seeing different medical practitioners, sports physicians, chiropractors, physios, and I just found that a lot of the things they told me and the way they treated me was quite anemic, to say the least. And there was a whole new world there to be discovered as far as musculoskeletal medicine was concerned, especially back in the 80s. We didn't know a lot. Sports medicine was in its infancy as well, compared to what it is today. So I ended up seeing an osteopath later on. He was a Canadian trained osteo, and he gave me what osteopathy was all about. Had no idea what osteopaths were. So, but I fell in love with the philosophy and the way they approached, dysfunctions, opposed to just looking at a single part body. I fell in love with the whole unit of what the human body can do as one, not as just a shoulder or the arm or the leg or the back. It's basically the body works in unison with each other, and one part would always affect something else. So it's actually that aspect that really got me interested.
And you studied at the International College of Osteopathy. Who were some of your mentors back in the day, and how did they really leave their mark on you?
I was lucky enough to study with Ivan Lallement, who was the dean of the college. He actually started osteopathy in Australia, with Peter Cash. Both of those brought a wealth of knowledge, because they basically modeled their osteopathy on the American, the AT Still style of osteopathy. So we got the pure osteopathy back then, and that were the two. They had the two biggest impact in my life as far as my education is concerned. Then Steve Porter came along as well. He was one of their graduates, and he put a lot of engineering, because he was an engineer prior to being an osteopath, and so he used a lot of vectors and forces and loads and how it affected the body. And he gave me the idea of as far as biomechanics and how far we can go with it, and the amount of load the body can take before it starts to reach the point of dysfunction. So it's all these ideas they sort of put forward, and it was like, it wasn't sort of evidence based. It was basically working on the premise of osteopathy, and we built on those ideas as well. And I think that's what osteopathy is all about as well. Is you learn from someone, you build the ideas from it, and then you go out and practice it.
Yeah, well, I asked a question the other day, and the question was, you're a new graduate, and you haven't really gotten results with anyone yet because you're a new graduate. Where do you get your confidence from? And most people would talk about, about education and learning and continuing learning, but I think for me, a lot of it was the things that I saw you do, and the things that you taught me, and I just had to trust that they work because I saw you making them work. And as a new graduate, I hadn't gotten results yet. And so I would see you do it. And then I would see the results and say, okay, well, if John can do it, John can get results. That gives me confidence that if I put in the effort and really have an open mind about learning, then I can get the results too. And that really gives you confidence. So I think that's where a lot of the confidence crisis is happening now with young practitioners, is that they don't believe in the principles. They think they're just floating around the sky. They don't actually think that those principles can offer results. And what you just said then about you just saw other people do it, and you didn't rely on evidence-based medicine, and you were really just you understood osteopathy and its philosophy, and it made sense to you, and the phenomenology was there. You saw it play out in practice, and phenomenology, I guess, is evidence, right? It's not lacking, but yeah, that just what you just said then really rang true. And so, give us some insight about being a young practitioner in those days, mate. When you graduated, tell me about what was it like, starting out?
Being a practitioner back in those days was really quite tough. Actually, we didn't have the amount of osteopaths that you have today, where you can join a practice. Most practices now would love to take on students. In my day, it was lacking. I think there was only about, I think by memory, 120 osteopaths in the country.
Wow.
And most of them were in New South Wales back then, and Victoria. But we couldn't practice in Victoria either, because every state had its own registration.
Yeah,
so because
right.
I was registered in New South Wales, I couldn't work in Victoria or Queensland because they all had separate registrations. That's how silly it was. Until we got the national, when we became the AOA, then we all joined, because we found that being one big profession instead of individual professions, we can get a lot more through legislation, and we have more pull as an association. But going through that situation as a student, it was basically what AT still said. Osteopathy can't be given on a silver platter, or nor can it be taught. One must seek and delve for it. So it was one of those things, it's trial and error. We were taught, we were armed with a whole lot of techniques, like most of you guys students come out with. But the thinking of osteopathy, if you go back and use those principles and understand that the human body self-regulates, it's self-healing and self-maintaining. If you work on that premise and you believe in that, then you can create that environment for that body to do those things. That's what we do as osteopaths. We don't heal them. The body does it.
You just move things out of the way.
Yeah.
Yeah.
So that's it. We're not just looking at one lesion pattern. We're looking at improving the whole function of this human body, this one unit.
Yeah.
And later on, we'll talk about that with the biodynamics and how I got onto that.
Okay. All right.
So yeah, as a student, it was through trial and error. I never had the opportunity to work with anyone. I got that opportunity when I bought Ivan out. Ivan was looking to go into the country at that stage. And even though it was so tough competing against three other, icon osteopaths, because these three osteopaths, Peter Cash, Steve Porter, Robert Goodsell, and Roman Maslach, were like the pinnacle of osteopathy in those days. They had a great name. And I joined that team, but I was flagging because I was a new student. But I had the opportunity to ask them questions and keep asking them questions, and I kept learning because I wanted to delve deeper into what I'm doing and how I can improve my skills, improve my diagnostic ability. And I was lucky enough to get that opportunity, and that's how I got my opportunity. Otherwise, I wouldn't have had that opportunity. So if you've got a chance to join a practice and learn from senior osteopaths, do so and ask as many questions as you can. That's my advice to students.
Great advice, mate. Let's talk about your clinical week. Just a week in the clinical life of John Abdullah. What does your clinical week look like now versus, say, what it looked like in the early 2000s? I remember working with you in the early 2000s. It was a very busy time. What is your? We'll get into that. But what does your clinical week look like now versus, say, what it looked like in the early 2000s? Tell us about what your week looks like at the moment.
Look, my weeks are booked out. usually 4 to 6 weeks in advance now. And, it's compared to PCOS was crazy. I think, we just had so many people. It was a big practice because we covered such a broad area. But now I sort of tend to focus just on basically dysfunction and improving function in the body, where PCOS was basically looking at sports medicine, occupational strains, postural problems, conditions.
Yeah.
So we covered a lot there. Now I tend to sort of specialize in one area. And I guess, people tend to, be driven or be attracted to that one area. So I'm not as practicing as basically, I mean, if I do get some sports injuries, it's fine. I'll still treat them. But generally now I just look at people pain, looking at basically what they're suffering with as far as their chronic pain condition and working through that. And I think that's one of the reasons why now I'm sort of so booked out in advance, is that because chronic conditions still need work. It's not a quick fix, basically.
No. Let me ask you, let me kind of segue into this a little bit because you've had experience on this. A few weeks ago, I put up some posts, and we're trying to get people engaged in the Success in Practice program. And I was basically discussing my own history with you, and especially when I was working out at the Parramatta Clinic, I was doing probably about maybe 100 a week in terms of numbers, and then when I took over Pico, so it was crazy. I mean, that was like, I think over 3 days you were doing something like 150 consults a week, and then when I mentioned those numbers to people, that once I started taking on both clinics, I had to really get some help because I kind of maxed out at about, I think, over 5 days, I maxed out at about 250, 200, 250, and I had to take on some practitioners. And when I mentioned those numbers, people kind of, were taken back, like, how that can't be osteopathic. You've heard this before, John. You've had this criticism, probably longer than I've had it. You can't practice osteopathy and treat people, that quickly or that efficiently, or efficient is probably not the word they would use. And so I want to get your take on this because, how do you reconcile, say, doing those kind of numbers, given the fact that in those days, you're a younger man and you were working hard and you had the desire probably to work hard. And what I said to people is that you have to have the desire to work hard. You have to be very good at pattern recognition. You can't dawdle around. There's no real fat on your treatments. And you have to have the mindset where if someone wants to trade your time for money, you got to be willing to lose them. So, if you can get someone good in 10 minutes, you get them good in 10 minutes. You don't need to spend the half an hour with them. And so that's how I've been able to do it. And I learned that largely from you. Do you have something to add to that? Hello, everyone. I'd like to take a quick moment to thank everyone for watching and listening to the podcast. If you have received value from this episode, the kindest thing you can do for me is to like, share, follow, and subscribe to the channel on whichever platform that you are listening on. If any of the conversations have resonated with you and you feel that I can help elevate your practice, you can find me at successinpractice.net. That is, the Success in Practice program can be found at successinpractice.net. The Success in Practice program is the signature program that takes a practitioner who may be struggling with retaining patients. They may not be certain about building effective treatment strategies, and they may feel somewhat anxious and doubtful about what they are going to do with a patient. And they are not really accelerating in the real world of private practice. It takes this practitioner and it turns their careers right around to the point where the patients have an effective diagnosis and a real treatment plan that they can take home. Patients are happy to book in multiple sessions with you, and they are confident about your abilities. And more importantly, you now have direction and are confident about your own abilities. The program streamlines how you operate as a practitioner. Guys, you should have been taught this at university, but you weren't. You may have been practicing for the last few years thinking there has to be a better way. There has to be a more effective way of engaging with patients and getting them results. Well, there is. And this is what the program delivers. Go to successinpractice.net and check out the options available to you. See where I can help you easily grow your patient list and finally earn the rewarding income that you deserve. For all the information on how you can reach me personally, check out the show notes. Also in the show notes, you'll find a link to the chat transcripts from these podcasts. These are valuable and a wealth of information. I really hope that you're enjoying the podcast. Guys, leave a comment if there's any questions on this episode. And please, don't forget to like, share, follow, and subscribe to the channel. Now, back to the show. You know, like that criticism of not being able to treat osteopathically and yet still.
I think when people, I have copped that criticism, and they go, "How do you do it?" And I say, "Oh, it's easy. Let me show you." What we do, it's basically how well you can diagnose. I've had students come through over the years, like yourself, and they go, "Oh my God, how quickly can you diagnose someone so quickly?" And the reason why you'll be able to diagnose, I always say, the more people you see, the better practitioner you're going to become, because you see so many people coming through. You have so much experience and so much exposure to different problems that, it's basically, you got to think quick. What are you going to try and achieve with this patient? What do I want to achieve today? Do I want to sort of get them moving? Do I want to get them out of pain? This is a criteria that you just got to look at. So each treatment that you do, you might only do 10 minutes. If someone comes with a really acute lower back strain, they're going to sit there, lay them on the back, on their stomach, and work for them for half an hour, an hour. They won't be able to get up because they're so congested and so much inflammation there that what you want to do, if it's an acute strain, you correct it. You might do a little bit of dry needling, correct it, and bang, they're gone. 10 minutes. But what you want, your aim was to get that facet moving, get that strain out of that facet, and have that neurological effect on that area. 2 days' time, they come back, or 3 days' time, and they're 70% better. Why? Is because what you achieved was basically to decrease the inflammation, get rid of that joint strain, and get that person mobile as quick as possible. You don't have to spend 5 hours on it.
No, that's right.
And that's my uptake. And so when you show people that, that's your aim. I mean, what else do you want to do with them?
Well, I guess what
you trick their neck when they're coming in with a cute low back.
Yeah, what you've said there, I mean, your ability to diagnose really well. Let me just define that. What you're really saying is your pattern recognition has to be on point. You've got to recognize the lesion pattern, and the better
you
you
understand the lesion pattern.
Yeah,
that's correct. Yeah, and when you do understand lesion patterns, like you'd always understand. Like I've had patients where they're coming mid-thoracic problem, but the problem's coming from their knee.
Yeah,
because the knee's semi-flexed, it's not locking back. And chiropractors or physios will keep looking at the mid-thoracics, but he's got a concavity that's created or a functional scoliosis at that point.
Yeah.
So what's the point? Sure, you can correct the thoracics, but it's going to come back if the knee's bent, which is creating a side bending through the pelvis.
Yeah.
So there's like just one really quick patterning that you might see, or I see, that other practitioners wouldn't pick up. And that's what will set the difference between you, an average practitioner, like basically an average practitioner, to someone that's very, very good. To recognize that.
All right. And can you, I mean, you touched on this in terms of having an aim for that particular treatment. Can you elaborate on the importance of having a plan in place for treatment, like a treatment plan? I remember, I mean, you used to come in, it's probably a lot, it's changed these days. It's a lot more formal now. But, back in the day, I remember you'd go in, and especially when you saw a new patient, you'd be very direct with them and tell them what their problem was pretty quickly. You'd offer a treatment that would kickstart the process of their healing. And then you'd basically tell them, I need to see you X amount of times, X amount of weeks, go outside and see, I think it was Kay or Moya back then, and go and book your treatments, and they'd just go and do it. And you've effectively given them a treatment plan then and there. And so, compared to saying, look, we've treated this, let's see how you go, come back next week. Comparing that first scenario to the second scenario, can you elaborate on that and tell us how important it is to have treatment plans in place so that
it's very important.
Yeah, sorry, so that your appointment book is full, and also so that patients get the care that they deserve.
Yeah, so Sammy, what I've found is that a lot of practitioners will treat patients only because they don't want to do the wrong thing. So they're either they don't know how long this problem's going to take. Like prognosis is very important. So when you look at a condition, and as you keep going through your practice, you should understand how long things are going to take you. One is because you as a practitioner know your own ability as far as how quickly you can get this person right. Two is basically you convey that to the patient as well, because patients want a plan. They want someone that knows what they're doing and sets a plan out for them from the beginning. Once you do that, then they can understand that you know what you're talking about. So you instill confidence into this patient. So if I say to someone, "Oh, look, you've got a disc prolapse," I can tell you now with herniations or discs, it takes me on average 2 months to get this person right, once a week. And I can tell them exactly the stages they're going to go through, the sort of pain they're going to go through whilst they're getting treatment, and how that pain's going to be characterized over the next couple or few weeks, over 3 weeks, and then what happens towards the end when they are improving. And to a T, sure enough, within about the 5th or 6th treatment, their symptoms basically obey. And by the time they get to their 7th and 8th week, they have no pain. They have no sciatic pain. Their straight leg race, positive straight leg race test, which they had in the beginning because of the compression on the sciatic nerve, has gone. Patients back doing most of the things they want to do. And then you start them on a rehabilitation plan after that. But also, then it's also important when you look at them that you want to sort of keep an eye on them over the next, few months, maybe every, 6 weeks to 8 weeks, to see how they're going.
And so if you're a young practitioner and you haven't had the experience to get those results, how do you navigate that? What are some tips that you can give a young
Okay, well, how you navigate that, you ask someone that's senior, that if you're working in the practice, and say, "I've got this person with a disc problem. I'm not sure, how long it's going to take me. It looks pretty bad. They've got a straight leg raise test of 15 degrees. They're pretty bad. Do I send them off to a surgeon or do I treat it? And if I do treat it, how do I treat it? And how long would it take me, if you think? Like, what would I tell them? And with your skills that you do have, I'm sure that with a senior practitioner there, he can show you basically how to do it, and why you'll treat this person in a certain way. Not everyone gets treated the same way when you got this as well, because you could have a 60 or 70-year-old. You're not going to be going around banging them away, swinging off the chandeliers, trying to correct their back, opposed to someone that's 18 or 19. So they're all treated differently, and both the age groups will react completely different to treatments as well.
Yeah.
Oldies, believe it or not, will get better a lot quicker than the young ones.
Yeah, right.
Because the young ones are more active, more mobile, and they want to do a lot more. With the oldies, they're happy to sit there with a heat pack on their back and not exercise.
Yeah, the oldies they've had their ego beaten down.
Yeah. But yeah, look, if you're just starting out, obviously you don't have the experience and you don't have the broad spectrum of patients and problems coming your way in the beginning. But what you do have is mentoring.
Well, also,
there's a lot of good practitioners out there. Your age, my age, Sammy, they've had a lot of experience, and we can show them the way.
If you, well, this is what I was talking about. At the very least, if you have that plan in place and you instill some confidence in the patient, they'll give you that leeway. They'll give you that, month, to kind of, where something it might take you, John, 3 or 4 sessions, it might take a new grad maybe 6 or 7 sessions. Look, if you've
but it doesn't matter.
If you put a plan in place, at least it'll give you that time to gain their confidence.
Exactly.
But if you're not putting that plan in place and you're not communicating that to them, and you're not telling them, look, this is what I need you to do. I can help you. You just got to be patient. This will turn around. You're going to get a little bit worse before you get better. You give them some of that information. Patients, most people are generous, and they'll give you time to get them better. And so I think having the plan in place, whether your skill set is still building, you need to have that plan in place. And I think that'll give you that extra time that you need to get where you want to get to.
Well, the thing is, if you don't have a plan in place, you're not going to have an opportunity to treat that patient either.
Yeah.
So it's really important that you do instill some sort of confidence in what you're doing for this patient. And as I said, patients always want direction.
Yeah.
If you're umming and ahhing and what you want to do with them, they're not going to come back.
No.
But if you say to you, this is what's going to happen over the 3 or 4 treatments or 5 treatments, this is how I'm going to correct it. And then we'll see how you go after that. We'll reassess how you're going after the 4th or 5th visit. And if they start to improve, that's great. Keep going.
So look, to kind of move away from the from humans now, and I know you've also been breeding horses and dogs these days. You've done the vet chiro diploma. What's happening for you on that front, and what component of your work does that comprise of? Like, how much of that are you doing these days?
I'm not doing as many equines at the moment, but only because the basically time constraints, and I'm getting older, so I'm not going to sort of go around traveling. I like to treat horses. Maybe I'll do that once I've given up humans. But I've got a pretty viable dog practice. I usually treat dogs, probably in the last hour of my either before lunch. So I book in a few dogs the days that I'm there. So I'm still doing 3 days a week. And the dogs are great. It's basically humans on four legs, so they're no different. The physiology and the structural that dogs have are quite similar to humans, only that they're basically quadrupeds and we're bipeds. So,
Osteopathy
um,
still applies, right?
yeah, osteopathy still applies, and the same principles apply.
Yeah.
You just got to be careful not to get bitten. That's all.
Yeah,
I mean,
right.
but other than that, yeah, look, animals are great. They can't talk to you, which is even better, um, because you don't want to be sitting there listening to yapping dogs all the day. But
Mate, I wish
it's no,
some of my
it's
patients were
great.
the
So
same.
yeah, look, dogs are great, and then because they're so they're not attached, they haven't got this emotional attachment to their
Yeah,
problems. They're quite motor orientated. So once you correct them, they respond really quite quickly
good.
to treatment. So yeah, so
Mate,
it's great.
you've been able to mentor many students over the years. Over hundreds, I would probably say, close to over 100 students anyway.
Mm.
Um, and you've seen the wide array, the wide spectrum, um, and you've seen the ones who excelled and the ones who have kind of fizzled out. What do you see as, say, three of the key components to success as a practitioner? So, if I wanted to be successful, what are some of the things I should possess as a practitioner?
Okay, one is basically the love of osteopathy. Do you really truly love what you're doing? Two is having confidence in what you're doing, having a belief that you can affect a change with the person, whether it be on a physical or emotional level. Um, and three, hard work and how hard you want to work to get there. I find those three things are really important. If you're not willing to put the hours in or the work, you're never going to build that skill set.
Yep.
You're going to be blasé about things. Well, then you're not going to reach the pinnacle or the height of what osteopathy can offer. And they're the three I believe make a really good practitioner.
And so, what do you think? What's the one thing that you feel young practitioners need that they just don't have or they're not exposed to? What do you think that's lacking that you're seeing that because you've obviously you're still seeing young students as they come through.
I say a lot.
What do you think is lacking at the moment?
Confidence. A
Confidence.
lot of it's confidence. I think a lot of it's lacking confidence and understanding of what osteopathy can really do. They really haven't grasped the deep concept of the human body as far as affecting change. Affecting a change in the environment where the human body then can correct itself and reach homeostasis.
Hmm.
And that's the thing. It's having that belief. It's the belief that you're not just putting heat packs on and doing a bit of soft tissue, and it's more than that.
Yeah.
Osteopathy is more than that. It works on a really deep level. Like from where I used to work before was purely musculoskeletal. Now I'm working on neuroemotional stuff.
Hmm.
And I've seen over the years how neuroemotional assaults on the human body, how it affects and the things they develop, whether it be swollen limbs, unable to talk, loss of hearing. It's just amazing. once you tap into exactly the depth of their emotional, um, what's the word for it? They're harvesting emotional. Oh, geez, I've forgotten the name of it now.
Like an emotional lesion.
Like an emotional lesion or an emotional assault, something that they've been really distressed with in their
Yeah,
life, and basically it comes out and manifests in the musculoskeletal system.
yeah,
And then using that musculoskeletal system plus your experience as far as counseling or um, sending them to someone that like either as a psychologist to deal with it, the changes are profound
yeah.
with these patients.
And so,
So
yeah, okay. Well, it's good that you've kind of been able to kind of grow from there, but it just shows the level of growth that's within osteopathy as well. It's
it is. There's a lot of growth. I've been doing it for 35 years, and I can honestly say there hasn't been one day that I haven't learned something new.
Mate, you mentioned Ivan Lullerman earlier as being one of your mentors. Not many people know about Ivan. Tell us a little bit about him. How was he personality-wise? I've heard that he was kind of a larger-than-life figure, and how did he operate as an osteopath?
Uh, Ivan was larger than life. He was a very strong-willed man, and he had a really strong belief in osteopathy and what it can do. His belief was that strong; it was almost like someone's having a belief in God. They have a really strong belief in God, and to him, osteopathy was his life. He made it his life. He was a strong figure. He was very loving as well. He was tough with us as students, and he wanted to get the best out of us. But he worked primarily on. He started off like the rest of us doing. He was a great HVLA practitioner. He was a great diagnostician, and then he moved on to doing cranial work, and then moved on to that treating mainly pediatrics. But with kids, it was fantastic. He was a really lovable guy. Everyone loved Ivan because of his personality, plus what he can offer to him as far as treatment's concerned. And he's installed a lot of my confidence over the years with his knowledge and what he can do. When I saw the changes he can affect on people, then I grew as a practitioner
Yeah,
because I can see what you said to me. I can see what he was doing. So I thought, wow, if he can do that, I want to do the same thing and maybe something a bit better as well. I want to improve on that.
yeah,
So, they're the sort of things you want to embark on being osteopaths. It's not so much just getting numbers in. Sure, you need numbers to pay off your bills, but I think if you offer everything that osteopathy can offer for people and change their life in some way, then keep them off that scrap heap, as they say.
yeah.
They'll be indebted to you, and they'll tell 10 other people. You know,
That's how it grows, mate. That's how it grows.
yeah.
Um, John, you're now using a lot of biodynamic techniques in your treatments. Can you shed some light on the evolution of that in your practice and how you distinguish between, say, using direct and indirect techniques? You kind of, it's not like you've stopped using HVLA, and some people think that, I've got to be one or the other, but how have you kind of brought that into your practice?
Okay, biodynamics. I got interested in biodynamics because it was a whole body approach. It was basically when I'm looking at mechanics, I'm looking at mechanics and looking at the straining patterns. But then there was other stuff happening on a deeper level in human bodies, whether it be deeper fascial problems. I was using some of um, uh, Thomas Meyer's work in anatomy trains and looking at all the fascial strains that develop from and the contours of fascia. Especially when it's sort of going around organs and your viscera. So I got more interested in that because I thought everything was sort of compartmentalized. Like you had your muscular problems, and you had your visceral problems, and you had your neurological problems. So I wanted something that incorporated everything, where I can diagnose everything just from basically looking at the respiratory system or feeling the respiratory system. And what I did then, I clarified that with what I found under my fingers, and then I did the biomechanical examination, and that turned out to be exactly what my fingers were telling me, the biodynamics. So that reassured me that what I was doing was correct, and everything I was doing with the biodynamics, it's a quicker way of assessing patients, and you can get more on the deeper level, whether it be fluid dynamics to the visceral problems, diagnosing physical conditions and neuroemotional conditions. So that's how I got into it. As far as direct and indirect techniques, sure, I still do direct techniques. If I find it's an articular problem, a purely articular problem, and that's where the fulcrum problem's coming from, as far as when I'm looking at biodynamics, I'll correct that using HVLA technique. I might even use MET. It really depends on, the age of the patient, how acute the patient is, um, whether they've got other pathological underlying conditions like osteoporosis. So, it's basically, I don't sit there and just, adjust or using direct techniques. I use indirect techniques for people that are mainly having, some deeper level problems like fluid dynamic problems with the diaphragmatic problems causing lymphatic buildup or venous buildup. Or they've got like deeper myofascial problems, which is creating their pain.
Okay.
So that's how I assess basically using those
Oh,
sort of techniques.
it's a broad range that you've and I guess it's focused, but it's allowed you to expand your skill set. Okay, John. So, mate, one more thing I wanted to discuss with you whilst we have everyone here is, mate, how do you see the future of osteopathy in Australia? You know, you've been around for a while. You've seen it come from obscurity, really, to now being quite a well-recognized profession. Although we still have a far way to go. But what are some of the challenges, and are we getting caught in any traps that you feel we need to be aware of as a profession? Hello, everyone. Just a quick break to give you some information on where to best find me. The first place is the private Facebook group called the Successful Practitioner Pathway. I've set up this private group as a place where practitioners can go and get tips and advice on how to best accelerate their practice and improve their clinical practice skills. The second place to find me is at successinpractice.net. That is where the Success in Practice signature program is housed. You can find more information about me and how I can best help you achieve success in your practice. So, the two best places, the private Facebook group, the Successful Practitioner Pathway, and successinpractice.net. I will link to both those places in the show notes. So, for more information, please see the show notes. Now, enjoy and back to the show.
Oh, I've got to think about that one. Look, we have grown over the years as a profession and a lot more well known now compared to what we were, say, even 20 years ago. Um, and we're growing on our peers as well as far as the medical professionals are concerned. I think that a lot of them are opting to choose osteopaths now as a choice for them, first choice over physiotherapy. I'm finding that on the coast. I mean, when I worked in Sydney, it was hard to get a GP to even listen to, let alone refer your patients. I think now with osteopaths being on the platform and, you know, um, basically our experience in musculoskeletal medicine, we're getting recognised amongst other professional peers, which is really good. I think. Look, I think we've got a long way to go. I think people know the public know who we are and they know what we can do. But the a lot of it was they're still quite when you speak to GPs or some specialists, they think you just do still a bit of doing a bit of soft tissue work and a bit of adjustments or cracking to them because that's what chiropractors have portrayed to them. Osteopathy is a lot more than that. I think we need to educate them a little bit more. I've been around and I've treated a lot of GPs as well in my practice and even specialists that come over and see me. So once they understand, you talk to them, they get a more of an insight and they go, wow, we can't believe that you guys can do those sort of things. we need to educate them a lot more. We need to get into, universities where, they're teaching medicine or physiotherapy and showing what osteopathy can do, and who we are and how we differ, you know,
Mm.
from all the other physical therapists or even medicine. And osteopathy is a science and it is a medicine. We don't use anything but medicine, really. We don't give drugs, but we use the muscular, we use anatomy, physiology, and we change that in human beings, using our techniques and methods. So we do it more naturally. So it's it's for them, it's hard for them to grasp that because they think the only way you can get a person better is by giving them certain tablets for certain conditions, which is fine. That might work, and a lot of times it doesn't work. So depending on what it is. So I think that's what we got to sort of, I think we should be heading towards that way. I think, and heading towards getting osteopaths more recognised as far as letting them into hospital systems. That's very, very important because it gives them an insight on conditions that people go through, looking at disease states as well and how that affects them, and certain things that we can do. Like I've been over the States many, many times, and I did a lot of my postgraduate studies there over the years. And they've got hospitals where you've got osteopaths, osteopathic physicians, which treat allopathically and use osteopathic techniques. And there's some of the hospitals that are just dedicated just doing osteopathic techniques, and they're documented. They've got evidence-based stuff where they'll use certain drugs for certain things. I say for asthmatics, I might give them X amount of Ventolin or prednisone, and then they'll use certain osteopathic techniques, and then they'll have osteopathic in one section where they're treating, and they'll treat the other ones with medication. And what they found was, osteopaths treating certain asthmatics, they've actually had a greater improvement and longevity in their symptom relief than what they did with taking medication. So
Yeah,
it was really quite interesting to see. And I think every osteopath should go over to the States and have that experience.
yeah, great, mate. I think with especially with evidence-based medicine, the way it's going, it kind of pushes allied health all in one direction. And I guess osteopathy is not going to be immune to that, but I think the main thing heading to the future is we need to keep some kind of identity, and protecting those principles definitely does that. And you mentioned kind of being in the hospital system. Well, we don't want to go in the hospital system if they think we're just going to go in there treating like physios. Nothing against physios. They do a great job in there. They have their place, but we have our own approach, and I think osteopaths need to go into hospitals treating like osteopaths. And I think
That's what osteopathy has its own identity, and I think that is true. We if we do go into the hospital system, we should treat like osteopaths as well. But I mean, we'll be limited to obviously the musculoskeletal problems.
yeah,
But I've treated a couple of emergency doctors that work at Gosford Hospital for problems that they've had. And one of them mentioned to me, they go, "Wish we need you guys in the emergency because they get disc problems, acute disc prolapses. They
mm,
don't know what to do with them.
yeah,
Basically, they just put them on pethidine, give them painkillers and maybe traction. But they've got no scope whatsoever in treating patients
yeah,
like that.
yeah,
So, there is a need for us in there, definitely, for things like that. For acute cervical strains like Ryan necks that people go in with,
mm,
chest pain. How many people have you heard, Sammy, that they've had chest pain and it's a rib problem? They thought they're having a heart attack, and so what
yeah,
do? They use resources. They call an ambulance, right? And they're rushed to hospital,
yeah,
and then they get all these tests done. They go, "Oh, we can't find anything. I think it's coming from your rib." So like if they had an osteopath basically in there, then, they consult an osteopath to see if there's a musculoskeletal dysfunction there first before they look at, any heart issues.
yeah. Mate, all valid points, and I think, like I said, it's we just need to. We're all heading that way. We just got to hold on to what makes us different, which is what you pointed out. Mate, I really want to thank you for your time today. Me and John are going to continue this conversation for my Success in Practice students, where we will discuss some very technical aspects of treatment technique. We'll look at some common pathologies that John sees in the clinic, and treatment of tissues, and basically I want to get his take on osteopathic principles. But for everyone else that's watching, that's not in the program, this is where the conversation will end. So I'll thank you, John, for your time, for those people, and I'm sure everyone's very grateful for the